Hello. Today, let me start off with the science behind the first ever photograph of a black hole that was released earlier this week. Then, I'm going to talk about the healthcare system in India. Let's look at India's fight against malnutrition, how pneumonia is affecting India's children, and how we could prevent misdiagnosing blood pressure. Plus, we'll also discuss some findings that could help develop rural India. I'm Annie, and this is Research Bytes, your daily dose of science news. First off, let's talk about last week's picture of a black hole. Were you a little bit confused by what looked like a coffee mug stain in space? I was, until I realized what it really meant. Until now, what a black hole looked like had been a bit of a mystery. We know that a black hole is a place in space where gravity's pull is so strong that not even light can escape it. The gravity is so much because matter has been squeezed into a tiny space, and this can happen when a star dies and collapses in on itself. But because no light can escape, people can't see black holes, they're invisible, and no telescope has ever taken a picture of this monstrous structure. This is because a single telescope simply could not look that far into the heart of a distant galaxy. So then, how did this team of scientists do the impossible? A black hole is so tiny from Earth that it's like trying to see an orange on the surface of the moon. You'd need a planet-sized telescope to actually get an image of a black hole. And that's exactly what the astrophysicists did. They used 8 telescopes across the globe in a collaboration called the Event Horizon Telescope. Now, a telescope doesn't actually take a picture. What happens is that light from the black hole travels 55 million light years, and all the telescopes collect this light at the same time. That data is recorded onto hard drives and then processed. But the data is incomplete, so the process of imaging takes this incomplete information from the virtual telescopes and then fills in all the missing gaps to get a picture that an actual Earth-sized telescope would have produced. But the scientists weren't just after a pretty picture. They wanted to know if the predictions that Albert Einstein made about a century ago in his theory of general relativity were true. And while everything they've observed so far about the black hole M87, its mass and the size of its event horizon are consistent with Einstein's theory. They found that the black hole had a mass 6.5 billion times that of the Sun, and the event horizon measures just under 40 billion kilometers across. And that thick ring at the bottom is because of the black hole's rotation. This image is just the beginning. Next, astrophysicists want to pivot their telescopes towards other black holes. And now that we've finally stared into the abyss, it's time to watch how it behaves. They say that the quickest way to a person's heart is through their stomach, and rightly so. Remember the last time you were hangry? I'm sure your friends do. While food is our bread and butter, nutritious food is the bedrock of our development, and India is facing massive challenges in giving nutritious food to all. Because of this, our most vulnerable, pregnant or lactating mothers and young children are suffering from malnutrition. India has tried to address this challenge through the Integrated Child Development Services Program called ICDS for short. This program provides nutrition and health support to those that are worst affected. ICDS is one of the world's most extensive nutrition programs. It provides take-home supplementary food, hot cooked meals, health and nutrition-related education, health checkups, immunization, growth monitoring, and preschool childcare services. The study says that could really benefit our most vulnerable. The study even showed that there was a decline in caste and tribe-based exclusion of those that needed this program. In fact, families gave equal importance to the girl child's benefit from these services too. But what concerned the researchers was the exclusion of the poorest sectors of society from the services that are provided by ICDS. The study pointed out that difficulties in reaching remote areas and exclusions because of caste within a village could be behind this. So maybe by addressing the underlying issues, we can make sure that good nutritious food reaches everyone's plates. Pneumonia is a potentially fatal lung infection that can be caused by bacteria, viruses, or fungi. The alveoli, small sacs in the lungs, get filled with pus, and this causes breathing difficulties. You can either get this disease from an infected person in your community or from a healthcare system. The former is called community-acquired pneumonia, and it is a leading cause of death in children under the age of 5. Globally, about 151 million cases are registered every year, and sadly, India is among the top 5 most affected countries. To understand these numbers, the researchers did a survey of 3,351 children from 240 villages in Lucknow. They found that around 24% of these children suffered from community-acquired pneumonia in the last 12 months. Shockingly, only 4% of them were hospitalized to treat the illness. They then conducted a hospital survey of 5,172 infected children that were admitted to hospitals in these districts. From this survey, they found the estimated incidence of community-acquired pneumonia in each of the 4 districts. The results showed that kids between 2 and 11 months had around 5 to 10 times higher rates of this illness when compared to children between 12 months and 5 years. What's scary is that more than half of the severe pneumonia cases in our country still don't get adequate care. And this is probably why there have been a high number of deaths. I honestly believe that prevention is better than cure. So let's put the P in pneumonia with strategies that prevent the spread of this disease. Hypertension or high blood pressure is known to be responsible for 57% of all stroke-related deaths and 24% of all coronary heart disease deaths in India. It's called a silent killer, and in our cities, about 1 in every 3 adults seems to suffer from high blood pressure. What's scary is that even fewer than half of them are even aware of their condition. But could it be that hypertension is being inaccurately diagnosed in India? Maybe that's why we have such high numbers. A study showed a 63% higher prevalence of hypertension when only a single blood pressure measurement was taken, in comparison to when an average of a second and third measurement were taken. A doctor might take just one blood pressure measurement because they may not have enough time, or simply because of the sheer number of patients that visit a healthcare facility. And since hypertension does not have any symptoms, in most cases, its diagnosis is purely based on a single measurement. These measurements are taken using a sphygmomanometer. This is the instrument that the doctor wraps around your arm and pumps air into. So how does this work? When blood is pushed through blood vessels, it exerts a pressure, which we call blood pressure. It's the highest when the heart is pumping and is called the systolic pressure. When the heart is at rest, this pressure is called the diastolic pressure. So a measurement of a person's blood pressure is made up of both the systolic and diastolic pressure. And a healthy reading is usually around 120 millimeters of mercury and 80 millimeters of mercury. Any systolic pressure values that are above 140 or diastolic pressure values beyond 90 are considered too high. But saying someone has high blood pressure by only looking at these numbers is not accurate. A person's blood pressure can vary because of many things like their breathing, emotions, exercise, meals, tobacco or alcohol use, pain, and even the ambient temperature. Since these measurements determine the health of a person's heart, and predict future heart-related events, we need to make sure that the diagnosis is correct. This is why simply taking these measurements at least 2 to 3 times is really important for patients, especially for those that are considered to suffer from high blood pressure. And what does an incorrect diagnosis mean? Well, for one, it means lifelong medications that are really expensive. And these errors sort of accumulate over time and contribute to inaccurate estimations of the prevalence of hypertension in the country. This then guides policy decisions and could escalate the associated healthcare costs. The simplistic results of this study have an important implication in the recently launched National Health Mission in India. Here, health and wellness centers play a pivotal role in diagnosing and managing non-communicable diseases like hypertension. The fast-paced march of an ever-developing country makes it very easy for rural and remote areas to get left behind. But for India to really grow as a country, we need to eradicate poverty and better the quality of life of every individual. About 66% of our population still lives in rural areas. There are a lot of government schemes that are designed to develop infrastructure and skills for the rural populace. This has helped to generate employment and also to decrease rural poverty. But in spite of these schemes, we have not been able to achieve our end goals in employment and livelihood generation. Right now, the government has about 18 schemes, and all of them aim to generate means of livelihood, eradicate poverty, and provide jobs that guarantee a minimum wage. But the problem lies in fund mismanagement and unequal budget allocation among the states, a lack of awareness about these schemes, and administrative negligence. This is what has dug a spoke in the wheel of our progress. Self-help groups have been proposed to address the gaps in government-run schemes. They are designed to cater to the needs of rural employment and focus on women empowerment. This proposed model is called resource symbiosis, and it was developed using the concept of bricolage. This is the construction or creation of something new, using combinations of pre-existing resources. So according to this model, these resources are used to allow both the villagers and the local government to benefit through livelihood generation and village development. A study applied this model on a village called Shingnagpur in Maharashtra. It has about 920 households that sustain themselves through agriculture. The researchers found that the village had entrepreneurial businesses, small things like retail shops, public distribution systems, and even small-scale industries like a milk processing unit, an amla processing unit, and mechanized farming. But in spite of this, the villagers still faced issues like indoor pollution from using firewood, electricity thefts, and irregular billing periods, open defecation, and a demand for agricultural water. The resource symbiosis model has 3 phases. The first is resource mobilization, by obtaining the necessary resources from the producer. Then, bricolage for village development, and finally, the implementation of government schemes that function in sync with each other. Now, livelihood could be generated in a village in 4 different ways. 1. By resolving scarcity of water and low income. Then, creating market linkages for surplus production. 3. Enabling efficient resource utilization. And finally, by helping the existing village enterprises to grow. This model could be customized and replicated in other villages based on their social and cultural needs. It can also support schemes like the National Rural Livelihood Mission and the Integrated Rural Development Plan by leveraging the concept of bricolage to allow policymakers to implement these programs for rural development. This is what could help India grow in a holistic way. Thank you for listening. Don't forget to like, share, and subscribe. Links to all my references can be found in the description. And for more science-based stories, podcasts, and news, log on to our website www.researchmatters.in.